This VAWatchdog.org news video is brought to you by Bergman & Moore, LLC. Former VA attorneys now fighting VA for you. Call Bergman & Moore at 877-838-2889 or on the web at vetlawyers.com.
That is a major concern for us, and it's one that we've taken great steps towards addressing the shortages. There's a national shortage of mental health professionals, which makes it difficult, although I will tell you, we've made a lot of progress. The VA, for example, has been able to add on nearly 4,000 mental health professionals over the last 2 years. Our TRICARE contract support partners, that would be HealthNet, Humana, and TriWest, over the last year, they've been able to add on an additional 3,000 mental health professionals. Currently, within the Department of Defense, we are working to fill about 1,000 additional billets for mental health professionals. We also have some public health service professionals who will be coming on to join the team, and I will tell you, everywhere I go, I put the word out to really help challenge folks, whether it be the American Psychiatric or American Psychological Association. The response has been tremendous. Because if you want a job, whether you're a social worker, a nurse, a psychiatrist, a psychologist, if you want to do something where at the end of the day, you never have to guess whether you're making a difference in the lives of those who need your help, this is the place to come.
What steps does your research suggest are needed to deal with especially the stigma problem?
Sure. Well, first we need to close the access gap, getting to the care. So we need to address the capacity issue that we've been discussing, making sure that there's enough mental health professionals and other health professionals who are trained in delivering the types of care that we know will be effective for those who are suffering from PTSD and depression.
Stop there for a minute. Why do you think there's a gap?
Well, we know there's a shortage in U.S. healthcare of mental health professionals. We know that there's a shortage of individuals who are trained in these types of therapies and these approaches. This is really a systemic issue across U.S. healthcare. We need to think about the pipeline of individuals coming into this profession so we can make sure they get the right training, they're in the systems where the veterans are going to seek care, and that we don't have this just moving providers from one place to another, but that we really have a strong pipeline of individuals who are coming into this career field.
And what other steps, what other kinds of steps do you think are needed?
Well, once we can address the concerns about the capacity and the supply of providers, we also need to address the concerns and remove the barriers that inhibit service members and veterans that have problems from getting care, like concerns about their career. We need to make sure that there are options and opportunities available for them to get help early before these problems accrue to a level where they are no longer able to do their job. We need to be able to offer services that are confidential, off the record, so that they do know that by getting help, they're increasing their fitness and the readiness of the force, and it won't be held against them in their career. But we also need to raise the gap in quality. We need to make sure that the care that is delivered throughout the sectors, the DoD, the VA, and the U.S. healthcare system, is providing the level of care that we know will have the most promise in facilitating recovery.
Mr. Forrester, you raised earlier one of the issues that's become a continuing issue in this war is the multiple deployments. Soldiers being sent back several times. To what extent is that exacerbating the kinds of problems we're talking about here?
It is a considerable factor exacerbating the problems. Once again, to the credit of the Department of Defense, there have been studies afoot for years looking at the effect of multiple deployments on service members. In particular, the Mental Health Advisory Team, MHAT, has now produced 5 reports in the course of the Iraq War and also now is covering Afghanistan. In the MHAT 4 report, the Army doctors, among others, found that the likelihood of a service member having a severe mental health problem, post-combat mental health problem, a wound, not an illness, a wound, it rose by about 60% from one deployment to another. The most recent report from the Mental Health Advisory Team 5 found when they looked specifically at non-commissioned officers, these are sergeants and others who lead troops into battle day in, day out, they found that if you compared an NCO on their first deployment to one on their 3rd or 4th deployment, that the likelihood of the person on their 3rd or 4th deployment having a mental health problem rose by about 129%. So this is the kind of problem. These problems are being generated day in, day out as we have multiple deployments. This is why it deserves a national conversation on what do we owe to these service members, for instance, the members of the Army Brigade combat teams, the members of the Marine Corps battalions who have been deployed again and again and again, And so we need to look at the cost that this is having on them, as well as what needs to be done. For instance, they need more time at home. Once again, the Department of Defense, through the Mental Health Advisory Team itself, says that more time at home, also known as dwell time, is a key variable in ensuring that these problems are dramatically reduced.
Do you accept that evaluation of the situation, especially about multiple deployments, and what does the military do to deal with that problem?
We are very concerned about that. We appreciate the advocacy and the shared concern around the country because this is a national conversation. To understand that never in the history of our republic that I'm aware of has so much been borne on the shoulders of so few on behalf of so many for such a long time. And so there are things that we must do to support the families, just some of the most heroic folks you will ever meet, the military family. We had a chance, of course, earlier this week to introduce the Sesame Workshop DVD that helps children talk with their parents about the changes related to deployments. But we also know that it's so important to get after that stigma, get after the culture. You know, stigma, as the Canadian Armed Forces are viewing it now, and I subscribe to this, they talk about it as being a toxic occupational work-related hazard, one that prevents service members, their families, veterans, their loved ones from getting the help that they need. So again, we are just really very excited about today as a major milestone in that journey.
But is it not part of the warrior tradition and culture that you have to deal with here, that people would sense that that's why they feel there's perceived as weak if they seek mental health? I mean, is it as serious as that to try to somehow wedge a way into what is a traditional military culture?
Well, and it's exactly the culture that we are working to transform. To help our service members, to help their families, our communities understand that seeking help, it is a sign of strength. It's a leadership issue. It's a readiness issue. But you know, it's important also to understand there's a whole continuum of stress. And so we work at this end to build resilience in our families and service members from the day they come into military service. And you know, there may be in the course of their duties, certainly what our troops are experiencing abroad in harm's way right now, where they come under tremendous stress, and they may react to some of that stress, in which case the leaders work with them and the medical community to mitigate those risks. Now, sometimes the stress becomes even more difficult, in which case someone may become injured. You heard Secretary Gates talk about the importance of psychological injuries as well as physical injuries. They're on an equal footing. We can intervene at every point along that continuum to prevent that service member from getting ill and requiring medical care. Of course, if and when a service member or their family does require that care, we want to have it there for them, and we want them to know it's a sign of strength to seek it.
All right, Colonel Lori Sutton, Terry Tennillian, and Jason Forrester. Thank you all very much.
Thank you so much.
VAWatchdog.org, the nation's #1 independent veterans website. On the web at VAWatchdog.org.